Okay, looks like the participants joining has slowed down, so I think we can get started now. Thanks everyone for joining. My name is Kate Cohen. I am the Shared Risk and Protective Factor peer-to-peer network lead. So you'll see that abbreviated in emails because it's a pretty long, long name of this group. If you could, as we get started, chat your names and states into the chat box, that would be great. I know there are a lot of us, so I'm not going to go around and do introductions, but I would love to get a better sense of everyone who's on the call. As you're doing that, I just wanted to make a couple of quick announcements. I am, after this webinar, going to send out a link to the recording. It says being recorded, and also to our new Thriving Communities Colorado website, where we're posting all of these learning opportunities. So if you think a colleague might benefit from this, you can definitely direct them to that website, and hopefully you find that helpful as a general resource around shared risk and protective factors, but also that's a place where you can request technical assistance from our team, as well as see the past recordings and sign up for our newsletter if you're interested. I'll also be sending out a link to a survey after this webinar, so please take just a minute to fill that out. It would be really helpful for us to get a sense of what folks are getting out of these calls, out of these meetings, and also for future learning opportunities. I do want to say a couple of things coming up that I'll reiterate at the end of the meeting as well. Next week, on Friday, the Shared Risk and Protective Factor peer-to-peer network is going to be having what will serve as our annual meeting. Obviously, this looks a little bit different than what we were hoping to have here in Colorado next week, but it'll be a 3-hour virtual meeting. So I hope that many of you are able to join us. If you missed the information about that, I'm actually going to be sending out another email about it in a couple of days. So just look out for that and a registration link for the meeting. So I'd love for all of you to join. And then we'll also be having more learning opportunities throughout the rest of the year that we'll send out more information about. Today I'm really excited because Deltavia Robertson is going to, and along with her colleagues, is going to be talking about Michigan's Shared Risk and Protective Factor policy tracking tool, which I had the chance to learn a little bit about, and maybe some of you did as well at the last Safe States conference, but it's really fascinating and I think will help advance this field and topic. So I'm excited to hear more about that today. Deltavia is the core state violence and injury prevention program coordinator with the Michigan Department of Public Health and Human Services. So Deltavia, I'll let you and your colleagues introduce yourselves a little bit more, but you should be able to share your screen. Let me know if you have any issues with that. Do you have that option? Oh, I probably need to stop sharing my screen. 1 second. Oops, and I'm gonna unmute you. There you go.
All right, perfect. So share and let me pull up. Can you all see? Okay, I'm assuming you can see this. So as Kate mentioned, I'm Deltavia Robertson with the Michigan Department of Health and Human Services, and very excited to be presenting today alongside the University of Michigan Injury Center, and specifically Amy Ruker will be presenting today to talk about the legislative tracking tool. And this is something that we've been working on for over 2 years now. And we're just really excited about the direction we're going with it. Before we jump to the legislative tracking tool, though, I wanted to talk a little bit briefly, just give you an overview of like our approach in general and where the tool and the legislative tracking kind of fits into what we're trying to do within our section. So just a brief overview, we are Michigan Department of Health. This is kind of giving you kind of our organizational overview. We're within the Division of Chronic Disease and Injury Control. And And we are split into 2 units. So we have intentional and unintentional injury. And then these are the programs that are within the section. So rape prevention and education, overdose, data to action, and so on and so forth. And I'm with the core SVIP program, which is a CDC funded program that addresses 4 focus areas: child abuse and neglect, intimate partner sexual violence, motor vehicle crashes, and traumatic brain injury. So this is kind of what we look like as a section. And then within these programs, some of us fall under the intentional injury unit, and then some of us fall under the unintentional injury unit, but we still pretty much work together and kind of operate as one section. And then I just wanted to bring in this because I think this is important for the conversation of some of our key external partners that we work with. And these are partners that all of our programs are kind of strategically working with to implement our strategies. So these are the ones you see on the screen today. We'll be talking with the University of Michigan Injury Prevention Center, but we do partner with a lot of other groups, as you can see. And so this process of kind of implementing a shared risk and protective factor approach, we're undergoing like an internal as well as an external process kind of happening at the same time. So that internal process looks like, you know, our department and our section doing a lot of trainings on what our shared risk and protective factor, what is the framework. We refer a lot to the Connecting the Dots documents and other CDC resources, in addition to bringing in kind of outside trainers from health management associates, HMA, to kind of talk to our group and do some more specific trainings about how it applies to our work together. And that has been ongoing. And you'll see in the next slide, I'll give you kind of a brief timeline of what we've been doing to date. And then the external, I kind of look at the legislative tracking tool as sort of external, because that is something that is kind of a public database that we are working with the University of Michigan to develop so that we can share this with our partners and they can then utilize that information to inform policy education work. So this is kind of our timeline. I won't go into all of the specifics, but we kind of started in 2017. I started with the department in September of 2017. So this work started around that same time. And this is some of the things we've been doing internally to kind of build this knowledge base around the shared risk and protective factor work. Uh-oh. What did I do? Okay. Okay, and then this is the continuation of the timeline. So kind of where we are, where we've been going since the October date. So a lot of trainings, some communication plan materials developed and different things to kind of help us put all of this work into language that we can communicate to our internal and external partners. And we're continuing to do that work as a section. And we did some readiness work with Safe States Alliance and HMA again to kind of figure out, you know, how well do our section staff and partners understand the concepts, and how basically how do they feel about taking on this approach? Do they feel we're ready to kind of move forward? And that was some of the evaluation that was done last year. And these are some of the results we got about the readiness. I think a lot of our partners generally felt like this is something that they understand and they're ready. I think there are some barriers that came out, like about funding expectations and such. And then our next steps with this work, we're going to be some more trainings coming up next week. We have a strategic planning meeting in July, continuing to have these deeper conversations about how we define, implement, and measure these protective factors. Specifically, our section is focused on connectedness. So we're doing a lot of talking and trying to define that for our section and what that looks like for us. And then, of course, implementation of the strategic plan, which will start later this year, going into next year. So that's kind of a overview of where we are with our work overall. And now I'll go ahead and pass the baton to Amy to talk specifically about the legislative tracking tool, which again, that is an external resource that we're working together to create for our partners.
Awesome. And then you have control of the slide still, Deltavia, right?
Yes.
Perfect. Okay, you can advance it.
Okay.
So I'm Amy Rooker. I'm a project coordinator at the Injury Prevention Center at University of Michigan, and I've worked really closely on this tool with Kate. Kate, if you also want to introduce yourself. Oh, you're muted. I forgot about that.
Sorry, what's Kate's last name? Oh, there.
How?
Oh, perfect. Thanks.
Hi, everyone. My name is Kate Howe. I work at the Prevention Research Center at the University of Michigan. So I work directly with Amy in our partnership with the Injury Prevention Center. And I'm looking forward to getting to know you all. Thank you.
Yeah, so Kate and I are now kind of at the helm of this tool and working to make it better and advancing the legislative analysis. So we're really excited to share it with you all today. So the purpose in creating the tool was to create something that would allow our different partners and stakeholders throughout the state working in injury and violence prevention to track different legislation that we thought they would need to be aware of and evaluate the landscape of injury and prevention related legislation, as well to work on evaluating the impact of shared risk and protective factor work that the CDC is doing. So you can go to the next slide. So our process for this, we are evaluating all bills that have come through the Michigan legislature in the 2017 to 18 session and the 2019 to 2020 session. So we're about halfway through on bills for this latest session so far. And we developed key search terms to flag for injury topics. We're only tracking bills related to our 3 core SRPF priorities in Michigan, and those are child car seats and restraints, abusive child head trauma, and teen dating violence. You can go to the next slide. So to develop these search terms, we used mesh terms, as well as looking through common key terms from citations on PubMed, and then also a search of Michigan legislature's database of bills and amendments to see what was coming up most commonly. And we had experts at the IPC and MDHHS review these in order to get our final list. Next. So all bills and amendments from 2017 and 18 and those that are available from 2019, 2020 so far that contained search terms for these injury topics were identified using a script that one of our data analysts wrote in R. And then we have 2 coders who determine the inclusion-exclusion criteria, third to resolve any disputes, and then those bills are updated into the tool bi-weekly. Next. So our inclusion-exclusion criteria for the 3 different topics are on the screen if you'd like to read them. Mostly for all of them, the search terms have to match. The bill or amendment has to be within the dates of analysis. For child car seats and restraints, it has to apply to children who are 8 years and old and under, but does not apply to children 8 years and older. Abusive child head trauma must apply to children who are 1 year older or under, and does not apply to children who are 1 year and older under. And then for teen dating violence, the bill has to apply to youth aged 11 and 18. And if the bill included these ages, but it also included other ages, we still included it. It was just if that age group just had to not be explicitly exempt from the bill in order to be included in analysis. And continue. So this is the link to our tracking tool. I have a screenshot so you can see, and then we can also share the link with this link to the tool with you all. So currently we have 85 bills that are being tracked in the tool. You can go to the next slide. So this is what the tool looks like. You can sort it. So we have the House bill or Senate bill name with a direct link to the page on the state legislature site, so you could read the full text of the bill. We have the sponsor, a brief description, as well as tracking where it is as far as House and Senate approval and passage all the way to public law, the last known status, and then as you keep going, it'll track injury topic area, so child restraints, abusive child head trauma, or teen dating violence. We're also tracking the impact area, which is either prevention, treatment, post-care, or this other impact area, which we're defining as social impact. And how we are defining that is any bill that affects the social environment or someone's social capital. So for example, a resolution that declares April Sexual Assault Awareness Month would have this social impact aspect because it's kind of broadly affecting the social framework and like keeping sexual assault awareness in all of our minds. Also, a bill that is about who must register for a sex offender registry would have this social impact aspect because that's going to affect someone's social capital and where they can live, what jobs they can apply for, things like that. The tool also tracks who the bill affects, just children or the general population. You can go to the next slide. So looking at the tools that we have, or the bills that we have in the tool so far, there's 85. The majority of them are on teen dating violence, followed by abusive child head trauma, then child restraints, and we had 2% of bills that were on teen dating violence and abusive head trauma. And the reason that a bill may have been included in both teen dating violence and abusive child head trauma is if the ages were all included in that bill. Continue. Looking by impact area, overwhelmingly majority of the bills, 53%, were affecting prevention, followed by some combination of prevention and this social impact that we're discussing. Fewest bills had to do with treatment, post-care, or some combination of the two. Next slide. So looking at the impact area by injury topic, for bills on teen dating violence, we mostly had bills that were dealing with this social impact. We did have a lot of different bills and resolutions in Michigan that were for things like, as I gave an example, declaring a certain month an awareness month. For abusive, how are we defining prevention? Yes, so yeah, anything with prevention is working to prevent that injury before it happens. So an example would be a bill that is about sex ed curriculum in a school. For abusive child head trauma, the majority of bills were about prevention. Continue, please. Child restraints, all 8 bills that are in the tool are working on prevention. And then we had a 50-50 split with prevention and social impact for the 2 bills on both dating violence and head trauma. Continue. So the next piece of this is our shared risk and protective factor analysis. So to first do this, we need to come up with new search terms that were specific to each shared risk and protective factor for our 3 injury areas. And we developed these search terms using the CDC's Connecting the Dots document, a review of published literature to see what were different shared risk and protective factors for these different topics. And again, we had expert review by people at U of M and at MDHHS. Continue. So for some preliminary results, the full text of the bills have been analyzed. We've analyzed 68 out of the 85 bills that are currently in the tool. So out of the 68 bills, 65 of them contained at least one shared risk and protective factor search term. So there was a total of almost 3,000 instances. However, after removing duplicates, there's 558 unique instances in 65 bills where a keyword was flagged. We went through and there were 83 exclusions where a word was flagged in a bill for a certain risk factor or protective factor, but that was not a factor for that injury topic. I can continue. So remaining, we had 473 unique times that a shared risk and protective factor keyword was contained in 65 bills. And after Jessica, who is the managing director for the Injury Prevention Center, myself and Kate went through and read each instance in all bills, we determined that there were 100 instances where shared risk and protective factor was used appropriately in these 65 bills, 21%. What that looks like is 30 out of 65 bills that had at least one instance of proper shared risk and protective factor language. Continue. So some of our things as we're working to define our search or refine our search terms, that were coming up a lot and causing false positives were words like anger are being flagged in danger. The word violence is flagging a lot for community violence, but it will be a bill about domestic violence. We're also seeing that for the shared risk and protective factor of a history of violent victimization and ACEs, the word victim is being flagged a lot, but it's not being used to denote a history of anything. It's just identifying the victim of a current crime or a current situation. Also, words like therapist, counselor, social worker are being flagged for access to mental health services, but these are being flagged in bills that are denoting who is a mandatory reporter for things like child abuse, and the bill is not actually doing anything to increase access for victims of child abuse to see a therapist or see a counselor. So in that case, the shared risk and protective factor language is not being used appropriately. And final example, words like employment or economic stress or college are being flagged for things like unemployment, economic stress, or low educational attainment, but these are denoting what information an offender must register on a sex offender registry. Continue. So looking at the bills that we've analyzed for our shared risk and protective factor language so far, we had 11 out of 30 bills that included shared risk and protective factor language for abusive childhood trauma. For teen dating violence, 13 out of the 27 bills included shared risk and protective factor language, and child restraints had the best percentage. 6 out of 7 bills included proper shared risk and protective factor language, and then none of the bills that affected both teen dating violence and child abusive head trauma included shared risk and protective factor language. So you can continue. Looking at this just a little bit differently, so the majority of the bills in the tool were on prevention, and 25% of them did contain shared risk and protective factor language. However, so we did see a lot of bills. If you'll see at the bottom, 13 bills were on prevention and this social impact, but none of those contain proper shared risk and protective factor language. So one of the things we're doing as we're going through is kind of looking at those. Why are these bills with this kind of social impact dropping out and not being used properly? Continue. Just another way to look at that, of the 30 bills that did contain shared risk and protective factor language, 25 of them were on prevention, 4 were on social impact, and 1 was on prevention and post-care, and then all other impact areas were excluded. So there are no bills on just post-care or just treatment that contain proper shared risk and protective factor language. Continue. So our goals and next steps, we're refining the search terms to improve our evaluation protocol. So it's one of the things I was doing today. So we're going through and seeing what search terms are being flagged inappropriately, what can we do to change these and make our process easier. We're going to look into if these bills with shared risk and protective factor language are more likely to be passed, and if not passed, to advance through committee, advance through the legislature. And then we're going to create a protocol document so that this can be shared with other states and also be expanded to include other injury topic areas. So, and we have plans with MDHHS to expand this to opioids in December. In addition to that, we're also working to will work to create white papers and info sheets that we can share with our policymakers in Michigan about how to make more effective legislation. And I believe that is it, and then we can answer any questions.
Yeah, thank you for that presentation, Amy. Do you all have any questions about the tool? We'll be sure to share the link with you, and so you can go into it. It's a Google document, so it's easy to click on and look at, and you can't edit it, of course, but you are able to like view what's in it, and then you can share it out.
Did you find the bills more focused on victim versus perpetrator or prevention?
For prevention, okay.
Hmm. I'm not positive. We haven't gone through.
That's a good question. Let me write that.
It is a good question. We kind of have been talking about it, but we haven't done. So far, we've just gone through and read through each instance where a search term was flagged in the bills and included it yes, no. We haven't taken a super in-depth analysis into each bill yet. Certainly, we will be doing that. One thing that we're noticing is, yeah, a lot of times a bill will be talking about the victim rather than the perpetrator. So that's one thing that we're having to decide of, is this proper shared risk and protective factor language? Because is it talking about the victim or the perpetrator and doing something to actually prevent a perpetrator from committing?
And also I would add that, so in the process of refining this tool and this process, we have, and we continue to share with our stakeholder groups. So we share this tool and get kind of feedback on what things that are relevant for our different stakeholders. So last time we shared it, I think was a couple of weeks ago actually. And some of the things, they're always looking for new things to kind of track within the tool. That's the beauty of it, that, you know, there's endless possibilities. And so one of the questions, in addition to what you asked, Beth, was also about enforcing. Is there anything that's like enforced within the bills? And so we're looking at different characteristics basically of the legislation to see what is going to be helpful for our partners. So this is just another strategy, especially when looking at the Stop Sexual Violence Technical Package. Yes. So yeah, we have a lot of ideas that we're getting from our partners about what sorts of things we can be tracking with the tool. And specifically our rape prevention and education partners were the ones that asked a lot of those similar questions as you. And those are things, one of the challenges with this, it does take a lot of hours to kind of sort through all of these bills. As you heard Amy talk about, 3 people are reading them. After they do the initial scan, you have individuals that are going back and reading the bills to try to basically double check if the risk and protective factors are used appropriately. And so that does take a lot of time. And the goal is to refine the process so that it's not taking up so much time and we can kind of do this a bit more quickly.
Yes.
And then I was going to say, this is Beth. Are you using like a search tool, like an electronic search tool to look for your words? Or are you physically going through the documents and reading them?
So we had one of our data analysts, Matt, write code that it's scanning the full text of the bills for these search terms. But then once we get that, we're physically opening each bill, Control F, finding and reading every instance of that search term in the bill. And then we're using just an all or nothing approach. So if the word victim is in a bill 15 times, we read the full bill to see each 15 times that word was used. And if it was used in a proper way, at least 1 out of those 15 times, then we're saying like, yes, this bill does include shared risk and protective factor language.
And I would just touch on that and say the tool, at least the code that we use to scan the bills, the tool is pretty sensitive, but obviously not very specific, like Amy
It's
said.
not very
there
specific
can
at all.
be
No, no.
Yeah, there are a lot of
Yeah.
circumstances where a word is flagged that maybe is part of another word, or used, not in the context of shared risk and protective factor language.
Yeah, we cast a very broad net with the search terms for our first pass at this. We didn't want to exclude anything that should have been included. So we are getting a lot of false positives, and that's one of the things that we're working to refine now, seeing what search terms we might be able to remove. But it's just something to keep in mind, especially since we do want to produce a technical package for this and share it with other states. It's like the way that legislatures in Michigan might write bills might be different from how people in Colorado write bills.
Right.
And so,
even the querying
it's just
process could be really different.
yeah.
Yeah, and that's a good question about how our partners are using this tool and how we're using it. So this tool, I think right now, it's kind of giving us sort of a baseline of what we're seeing as far as our work around educating leaders and policymakers about the shared risk and protective factor approach. So really what it's telling us is we have a lot of work to do in this area. It's not something that a lot of people seem to understand, or maybe they're using different terms, different terminologies to kind of get at the same thing. That's definitely another challenge, because we do have a lot of our partners, especially in the child abuse and neglect area, that do this work, but they're not necessarily using the exact terms that we use in shared risk and protective factor in our search terms maybe, or in the connecting the dots documentation. So one of the things that we're going to have to do is come up with a shared definition of, like, some of these areas, and agree on like what is a search, what should be a search term and all of that, because I do know that and that's one of the challenges with shared risk and protective factors is it's new, but it's not new at the same time, like a lot of things with public health. So we have a lot of people in like the ACEs area that are doing very similar work, but they may be calling it something else. We have partners in other, areas that are doing very similar, and maybe they're not using the exact same language. And with this type of, analysis, it's going to be really hard to capture everything that maybe have the same the same goal and the same overall purpose, but the terms are just different. So that's just conversations with our partners, and that's why we continue to share it out. But it still does give us some helpful information about like where we stand and what work we still need to do. And the great thing about the tool too is especially with the child abuse and neglect, a lot of times it helps us identify maybe some new partners that we should be engaging. So from our last conversation, we were able to engage like Michigan's children and use this tool to kind of maybe talk about some advocacy work that needs to be done, as well as the great thing about the tool is you kind of see the sponsors of the bill. And so maybe there's a possibility to be even more targeted with communication efforts and relationship building and things like that. Exactly. The phrase shared risk and protection does not seem to land with a lot of folks. I fully agree. I think we're really struggling with with that because it's a mouthful, and it's just something that we're going to have to make a decision about, I think, within our department on which way we want to go with it. We still want to be addressing the risk and protective factors, but maybe, we don't have to refer to it as a shared risk and protective factor approach, but still get to the same end result. So that's something that we're discovering too as we kind of do this tracking. But I do think there's a lot of use in using this tool for your policy education efforts and understanding and measuring to be more targeted in those areas. So that's one of the things that we would like to do going forward. And our partners, specifically our child abuse and neglect partners, our brain injury partners, and our child passenger safety partners are very interested in this. Any other questions?
have some, but I also want to leave time for other people. I was wondering, well, first off, thank you so much for a really great presentation, and I'm glad that Amy, you spoke to the goals and the next steps. I was wondering, kind of long term, if you could speak to some of the goals for this beyond beyond the legislative tracking tool. I guess what you hope to get out of it the next few years or however long it takes, you know.
Well, we are working our goal past just the tracking tools. So we'll be tracking through the legislative analysis for the shared risk and protective factor language. Will be including the bills up through this calendar year. And then we do plan to keep tracking the bills, but then we'll move our analysis into the white papers and kind of, we plan to write some different descriptive papers on this, kind of describing what we're seeing in these different bills. Kate can speak to that too. I know she's very interested in that. Our biggest goal is to be able to expand this to especially opioids, which I know we are in the preliminary stages of starting to do. So we're, I think, most excited about that. But
yeah, I would say,
can you speak to that more, Deltavier?
For sure. So in addition to tracking and monitoring the legislation, that is important because we continue to do that. And before I go to the future, what we learned from this too is there are a lot of bills that we weren't aware of, just because, you get a million emails and we're not all able to track, all 80 something bills. And so even during this process, I think we are discovering things that we weren't fully aware of. But I think the goal really is education efforts, like trying to inform our policy, education, and communication, because we don't do very much of that. And maybe this is an opportunity for us to, see where we can do more work around policy education and policy work, maybe identifying some more stakeholders that we should be working with. We currently don't have a lot of, or we don't have enough, I would say, of like community-based groups. We're heavy on the government, like the state government partnerships, which is fine, but we do want to start working more with our local partners and hopefully getting the tool in their hands, right? So that can empower them with the information, so that because you can sort the tool, if you're only concerned with child abuse legislation or opioid legislation or whatever it is, it can be very kind of specific to our different partners, and they can use that to kind of inform some of their work.
Yeah, I could see this really being helpful in informing any gaps in public health work too, of like where we're reaching policymakers, where we're already doing a lot of education efforts, and where we might need to do a little bit more, and to be able to track progress on these different issues.
Yeah, I think that's really where we're focused now, is tracking our progress. Well, first seeing where we are at, and then tracking our progress, and I think that's an ongoing process, right? As we continue to try to improve, and then see how we're doing in that arena, and then hopefully this is something that maybe would even grow beyond just our section and just injury prevention, right? Because if we're looking at shared risk and protective factors, it doesn't just apply to injury prevention. A lot of these kind of go to other focus areas within even our division. I mean, that will take a lot of resources to do something like that. But we know that there's a lot of interest in it, because it's just easy for anybody to go in and kind of look and get the information that they want to know right off bat, versus having to piece together from different sources, like what's happening with certain policies. Do we have any other questions? I agree with Felice about the language and the phrasing, and maybe it makes sense internally, but with our external communication, it does need to be tweaked. So if other states have some examples of doing this and maybe how they're able to communicate externally, we would love to hear what you guys are doing.
And so I'll put a plug in for a conversation that we're having next week on Friday, all around where the term shared risk and protective factors or ACEs or whatever matters and where it might not. And so, yes, definitely, Beth, this is absolutely a national conversation. And I think that'll be, so that'll be another good opportunity to talk about it. But yeah, I mean, let's open it up now. If anyone has examples from their states, I think it would be great to hear that.
Mm-hmm.
CDC speak.
In New Hampshire, can you hear me okay?
Sorry, Joanne, if you're talking, I think it's just a little quiet.
Can you hear me better?
A little bit. It's a little crackly, but we can hear you a little bit more.
There we go. How's that?
Perfect. Thanks.
Okay. Sorry for that. For risk and protective factors, we wrote our state injury prevention report, which has a section for all these different topics for violence, TBI, motor vehicle crash, rape prevention, all kinds of things, using the risk and protective factors. And we're kind of challenging ourselves to go down to the root cause and address risk and protective factors that go across all the different ways people can hurt themselves. Would it be helpful if I sent you all a copy of our state injury prevention plan?
Yeah, that would be great, Joanne. Do you want to put that in the chat box, or do you want to?
Sure.
Did you want?
Sure, I'll put a link to that in the chat box.
Thank you.
Right, and social determinants of health, we're also doing some work around that as well in our division.
And Deltavia, I was going to ask you earlier, you talked about this upcoming, I think it was you that was talking about the upcoming shared risk and protective factor strategic plan meeting. And I was wondering, I know in Colorado, that one thing that's been a big topic of conversation is who to involve in that and whether, how many external stakeholders or if we have external stakeholders. So could you speak to who you generally engage in that?
That's a great question. I think it's going to primarily be internal, and we are toying with the idea of inviting some of our core partners to that, just because we don't want to leave them behind in this process. They've been engaged here and there, but a lot of the work, a lot of the, especially the trainings have been internal, and then we would have to have a second training to kind of like make sure we're all on the same page. But I think what we're finding is it's good to just have us all working together from the beginning, or from the earlier phases of it. And so we may invite some external partners to that, especially because if you saw on the timeline, we've already had a communication plan. So we have a communication plan process that happened last year. And in that process, we already have a list of our core partners. We already know like who some of our strategic partners are and, who also needs to be at the table. So we kind of have done some work around like how we can communicate this externally and internally and all of that. And so my guess is that it's going to be, I would say, like majority internal, but then we'll probably invite a few of our key partners along for that. And that's going to be July 1st. And then shortly after that in August, we'll start the next phase, which would be the implementation.
Great. Thanks.
So, yeah. So basically it'll be like University of Michigan Injury Center, right? It'll be like our Michigan Public Health Institute. A lot of the partners that we work with all of our programs across the board that we work closely with, they're most likely are going to be a part of that process.
Michelle's comment, which I can read, and then it actually I want to open it up for other folks to chime in too. In Oklahoma, we have struggled with this. I oversee a committee, and we have a policy and legislative subcommittee that is composed of health department advocates from local DVSA agencies, community members, teen pregnancy specialists, and some RPE people. I would love to see them be inspired by this. Our coalition also tracks legislation and pushes for change. They have joined the subcommittee, but haven't been as engaged because of all the things they are working on. This is such a helpful example, Michelle. Thank you for sharing, because I actually did want to ask if other folks from other states have any kind of legislative tracking tool that they're using. Like in Colorado, we don't do anything as kind of scientific or automated, but we do track legislation related to our issue areas. I would really love to hear from other states if you have more examples of this, how you track legislation. And this goes for Michigan too, how it maybe was impacted this session, because for us, it's been paused for a little while. So please feel free to unmute yourself or type into the chat box.
I just want to say I love that you all have the legislative subcommittee. We really wanted to create one. It just never got off the ground. But we just kind of, we within our regular stakeholder, like core stakeholder group meetings, which are quarterly, we have a standing agenda item that is basically a policy kind of update, and then that's where the tool, and we just basically mark off time to have these conversations at that time instead of having a separate subcommittee. But you know, sometimes you can get more work done if you had a subcommittee. It's just folks are just busy. But yeah.
Yeah, this is Michelle, sorry, hi. So thank you for that comment too. We've just struggled so much. It's taken a long time to build the committee as it is. We have a higher education subcommittee, a youth advisory subcommittee with actual youth and young adults, which is really cool. And then we have one that's called the Oklahoma Prevention Education Network, which the whole premise is like looking at risk and protective factors and getting people from teen pregnancy, homeless prevention, people, suicide, drug and alcohol, all coming together. And then we have policy and legislation, but the policy and legislative one has really struggled because what we're finding, and probably, I don't know if other people will nod their heads or kind of echo the sentiments. They're all like our health department, where I am housed in with RPE, is doing their own legislative tracking. Our coalition is doing its own legislative tracking. There's the DVSA agencies are doing their own, and it's like, come on, y'all, get out of the silos and come together, and then let's make this work, because we're all going down the same highway for the same vision. Mm-hmm. Yes, we all are dictated by certain parameters of grants or requirements or whatever, but we're all trying to do the same thing. We're all trying to implement the same thing. And so, but that's the part, and the give and take and finding that balance is that, like you said, like, it's really great to carve out intentional time, like at a big meeting, which is what we do, but we also do announcements, and we do have a legislation portion of that as well. But the in-between work, it's been really hard because everyone's like, we value this, we need this. So I'm hoping to be able to take this and what you all presented today, and I think it was mentioned that it was going to be recorded, and all this stuff is going to be shared, and to share it with the policy and legislative subcommittee to be like, y'all aren't the only ones trying to do this, and we can kind of learn from other people's experiences. So that all to say, I just wanted to say thank you again so much, because this is this is exactly, I think we need this so that people can have like a visual representation. And then my only question would be, do you all feel like you have the same struggles of getting people to the table and keeping them engaged, like, and all that good stuff?
Yes, and I'm glad your comment is spot on. And I actually think that is probably the next phase for us with this work is creating a legislative subcommittee, because there is work that needs to be done in between these meetings, right? We only meet quarterly, and the problem is engaging people and really engaging, like identifying the right people. And that is just, that always is, can be a challenge, but we continue to try to what we do is every meeting we kind of, and you probably do this too, is carve out time to like try to identify new partners that need to be involved in this policy work. And so that's usually where I get a lot of referrals from that. And then it's basically just trying to get more and more referrals. Oh, cool. Thank you for sharing your legislative trackers. And getting more referrals that way. But it is very difficult. It's a full-time job almost to manage this these different committees and this kind of work. And so that is the challenge. That's why I'm always looking for existing meetings and how we can just leverage the time that we already have together.
How else are other folks tracking legislation, if at all? I'm interested to hear about this. And Deltavia, I think you might have mentioned some other states that you knew of that were doing something similar or wanted to. Is that right?
Oh goodness,
Maybe I'm wrong.
yes.
Okay.
Yes, we've had a lot of interest. A lot of states reach out to us that either were doing this or interested in doing this. And so I know, and of course, the CDC is very much interested in this work. And so they actually gave us a lot of resources in the beginning in terms of the search terms that we started with. And so I know that there are some states that are interested in it. I can't think of any off the top of my head. We just did a similar presentation to Washington State, and I forget their peer learning group, the WP something.
I'm not sure, but feel free to chime in if other.
Yeah, if you all know, but their peer learning group out there. And so that was a very similar conversation of folks just curious about what this looks like and how we're using it and how they can maybe adopt something similar. But it took us probably a year, I would say, to get everything started as far as identifying the terms and, agreeing on like the search terms and the methodology basically to get it started. And then, like she said, they're updating it bi-weekly now. They have one person that updates it bi-weekly. So, I mean, it's a time commitment, but once it's created, I think it's, and once we refine it, I would hope that it's something that MDHHS can maintain. Like we'll have somebody that can go in and kind of maintain it, on a weekly basis for us.
Kate and Deltavia, this is Jane in Louisiana, and we're somewhere between you guys. I think, Deltavia, we were at the session at Safe States, and we loved your stuff. And so we'll probably talk to you guys about it, but that seems like it was all so long ago in September. And Kate, then we have something more informal. We have a couple things going on. So our injury program is within our Bureau of Family Health. So we have sort of legislative tracking and huddles prior to and throughout the legislative session. That includes everything from Title V, kind of maternal child health stuff, and then some injury stuff. But it's really kind of tied to, bills and things that our Office of Public Health put forward. So it's not everything that's out there that touches injury, but we do have for the last couple of years, last year and then this year, we have a small little contract with, it was either LSU Law School or Loyola University Law School, to have students who actually have cataloged the laws that relate to injury, especially the core SVIP areas. And so it's not active monitoring during the session because the school doesn't want it set up while they're in classes, but they kind of do a de facto, pulling everything that came, and there right now the session is still going on, but pulling everything that came up from the duration of the session and then also the outcomes of what happened with those bills. So we're starting to catalog some of that, but we don't have anything as cool as that tracker. And one of the things that, and then because of COVID too, our session was paused. It's back on now, but it's like a free-for-all, and it's all kind of fiscal and budget. How are we going to dig ourselves out of this big giant hole sort of thing. But there are a couple of things that were kind of coming through, especially related to maternal mortality and stuff like that. But one of the things too, and I'm sorry if I missed this, Amy and Kate and Deltavia, when you were talking about the tool, but one of the things too, I know I did hear that you know, people are using the shared risk and protective factors kind of loosely, and then you're trying to decide if there really was any impact on the people it was intended to protect, so to speak. But, you know, what about like, are you capturing like just how enforceable some of these things are? Because I know that's a big thing in our state. Like sometimes we have legislation that looks really good on the surface, but it's not really, nobody really ever enforces it. Or, you know, it's not, it could be enforced, but it's not, or it's really hard to enforce. Did you ever catalog any of that?
Yes, that's exactly one of the issues that were raised at our last stakeholder meeting about enforceable. And so we are going to be monitoring that, tracking that as well, because we understand that this is only like the bare minimum of what we want to see, right? But if it's not actually enforceable, then maybe it's not really, you know, doing enough to prevent the injury in the injury area. So in this tool, you won't see like a category for enforceable, but that is something that is planned for future analysis, because we understand that that is basically another important factor to look for. It was two more that we wanted to track, and I can't remember off the top of my head, but definitely if they're enforceable was one of them.
If they're mandated or not.
Mandated, yeah.
Yeah.
And maybe funding or something like that. I can't remember now, but
because there are those unfunded mandates, you know, that are out of
yeah.
legislative sessions.
So yeah, we're looking at a bunch of different variables that we are going to, that will probably go into like a bigger analysis down the line. So yeah, those are great points that you raised. And I mean, you guys are off to a good start. I mean, you guys are doing some work in Louisiana. So I'd love to see what you all are doing and if there's any way that we can help.
Yeah, I would love to. I know the presentation's probably going to have the link. I saw it on the slide earlier to the tool, because that's one of the things that I would like to, you know, trying to get this legal kind of work and the public health law kind of workforce thing so that it does become something where they're more involved in kind of the actual session, the students. And I would love having like a really clean tracker, like some examples. I know I've shared Maryland's with them last year, but I'd love to share, if that's okay, guys, with them, to say this is an example of something we're working towards.
Yeah, absolutely.
Thank you.
Thank you, Jane. And please, you know, I know we're about out of time, and I'll do some wrap up, but I would love to continue to hear some examples of how folks are tracking legislation in their states, and I'm sure Michigan would too. And so please continue to kind of share that around. You can always send it to me, kate.cohen@state.co.us, as you probably all are very well familiar by now, and I can share it out. But thank you so much, Deltavia and Amy and Kate, for such a great presentation. I know it was really fascinating to me, and I'm sure everyone else enjoyed it as well. Anything to add before I just give a couple of quick announcements?
No, it's all yours.
Great, thank you so much. So as you can see, Rachel just sent out, Rachel's new to our team, and just sent out the survey. That would be great if, hi Rachel, if you could all fill it out to let us know what you thought about today and what you want to learn in future webinars. The next ones will be in August and November, but before that, again, next week, we're going to have kind of an all-team meeting for the Shared Risk and Protective Factor peer-to-peer network on Friday, the 29th, next week. And so I'll send out additional details for that. Please register ahead of time if you're planning on attending, to give us a sense of how many people we can expect. But we'll have a whole conversation and panel devoted to talking about shared risk and protective factor language that we use. And then we'll also hear from a few case studies from Alaska, from New York, and from Colorado local communities that have been implementing shared risk and protective factors as an approach to address opioid prevention as well as other issues. And so that'll be really great, and I hope to see a lot of you there. But in the meantime, look out for this recording, the survey, and a link to the new Google site, Thriving Communities Colorado, that'll have all of this listed on there as well. And please feel free to reach out with any questions or ideas or comments. So thank you, everybody. That's all I have for you.
Thank you very much.
Thank you. Bye.
Have a nice week.
You too. Bye.
Thank you.
Bye.